Hi everybody, I'm Dr. Lynch and I'm the director of EBM, and today we're starting your EBM content with this paper, and we're just going to do a brief overview of the paper in these videos. You have access to the paper, but you don't have to read the whole paper. We're going to show you in these videos how to um, get a summary of the paper by looking at the abstract and the tables, and we're going to talk a little bit about some of the details of the paper. So I'm going to give you a general overview, and then Dr. Patwari is going to talk to you in the next video about the tables. And you'll learn more over time about the concepts that go into these papers, and so eventually you'll be reading the actual papers, but we're just going to dive in, give you a summary today. Okay, so today's paper is oseltamivir treatment for influenza in adults, a meta-analysis of randomized controlled trials. And the goal of the paper is to determine whether oseltamivir treatment, which is Tamiflu, is effective in treating the flu in adults. So this is a meta-analysis, that's the study design. And so as you learned in your paper, your reading for today, there's a hierarchy of evidence, and different study designs provide different kinds of evidence of different strengths for a treatment or a hypothesis in evidence-based medicine. So here's an example of an evidence hierarchy. So the systematic review is at the top of the hierarchy, and a meta-analysis is a type of systematic review. And then you can see the other study designs under here ordered in terms of the strength of the evidence that they provide. So the randomized controlled trial, you can see, provides the strongest kind of evidence for a single study design. So obviously when you combine multiple randomized controlled trials, as we are here in a meta-analysis, the evidence is even stronger. So quickly, let's just talk about what a randomized controlled trial is so you understand. So in this case of our paper, again, the analysis is combining multiple randomized controlled trials looking at the effect of Tamiflu on influenza in adults. So here's our patients. So these patients come in to the clinic or the hospital, and they have symptoms of the flu, right? And there's a lot of differences among the patients. Then they get randomized into two groups, either the treatment group or the control group. And the treatment group gets Tamiflu, and the control group gets a placebo. So that's what a randomized controlled trial looks like, and the key here is randomization. And the reason that that's important is because it assures that the other characteristics that of the patients, right, the ways that the patients differ, are distributed equally across the two groups, so that they're not biasing the outcome. So perhaps Tamiflu works better in people with blonde hair, and so if you put all the people with blonde hair in one group, it would really, it would look like Tamiflu is better, but really it would be because of their blonde hair. So you want any other characteristics aside from the treatment to be equal across the group. So that's why randomization in a randomized controlled trial is the best study design. Okay, so let's go back to the paper and look at the abstract. So reading the abstract is one way of getting a really quick overview of what the paper is about. So starting with the summary, we can see that the reason that they did the study is because questions remain about the efficacy of oseltamivir in treating the flu. Okay, so then we can skip down to the methods. And note that they included all published and unpublished studies that they could find, randomized controlled trials where there's a placebo and they're double blind, meaning the patients and the researchers didn't know what group the patients were in, what medication, whether they were taking Tamiflu. And all of the people in the treatment arm were getting 75 milligrams twice a day of oseltamivir. Okay, so there were these similarities across the studies. So then they're talking about how they found the studies that were published, where they looked for the studies, and then talking about the primary outcome is important. So what are they looking at? They're looking at the time to alleviation of all symptoms. So does Tamiflu reduce the time to alleviation of symptoms? So down to the findings, they found 9 trials, which included over 4,000 patients. Okay, and then they found overall the main results were that there was a 21% shorter time to alleviation of symptoms in the oseltamivir group versus the placebo. And you can see the median time to alleviation was 97 hours for oseltamivir and 122 for placebo, with a difference of 25 hours. So that's about a day's difference. And they also looked at complications to see were there more complications in the patients that got Tamiflu, because that would obviously be a downside of using Tamiflu. So they found fewer respiratory tract complications that required antibiotics in patients that were given Tamiflu, and fewer admittances to the hospital. With regard to safety, they found that there was an increase in risk of nausea among the Tamiflu patients, nausea and vomiting as well. Okay, but then there was no effect on neurological or psychiatric disorders. So you're going to be learning how to interpret all these numbers over the course of the next few months. But for now, this gives you a sense of how you can sort of skim an abstract to get an overall sense of what the trial showed. And then finally, you can see the conclusion here. Oseltamivir in adults accelerates the time to clinical symptom alleviation, reduces risk of respiratory tract complications and admittance to hospital, but increases occurrence of nausea and vomiting. So that's a really quick way to get an overall picture of the reason for the study, the methods of the study, and then the results of the study. So now Dr. Patwari is going to show you in the next video how to read the tables in the paper to get even more detailed understanding of what the results of the paper are. And again, we'll go over this again in more detail, so this is just a quick introduction to reading the medical literature.